Musculoskeletal pain is a widespread health issue affecting millions of people globally. It includes conditions like low back pain, osteoarthritis, and rheumatoid arthritis, which can cause significant discomfort, stiffness, and loss of mobility. These conditions not only impact physical health, but also interfere with daily activities, emotional well-being, and quality of life. In the UK alone, nearly 19 million people live with a musculoskeletal disorder, representing a substantial portion of the population. The prevalence of these conditions increases with age, making them a growing concern as populations age worldwide. Understanding the scope and impact of musculoskeletal pain is the first step toward effective management and relief. Musculoskeletal pain is not just a personal health issue, it's a global challenge. Surveys across Europe, America, and other regions reveal that up to one-third of adults live with persistent musculoskeletal pain. This burden translates into significant economic costs, with billions spent annually on direct medical care, and even more lost due to reduced productivity and disability. For example, back pain alone costs the UK over £11 billion each year. Impact extends beyond economics, affecting families, workplaces, and communities. Recognizing the global scale of musculoskeletal pain highlights the urgent need for effective and accessible treatments. Living with musculoskeletal pain often means more than just physical discomfort. Many sufferers experience emotional distress, depression, and a reduced ability to participate in daily life. Surveys show that nearly 60% of people with musculoskeletal pain report a significant decline in their quality of life. Emotional well-being is also affected, with many individuals feeling helpless or unable to function normally. These effects ripple out to family and friends, creating a broader social impact. Addressing musculoskeletal pain is therefore essential not only for physical health, but also for emotional and social well-being. Musculoskeletal conditions are a leading cause of disability worldwide. According to the Global Burden of Disease Project, these conditions account for more than 20% of all years lived with disability, YLD. Low back pain, in particular, is the top cause of YLD for both men and women in many countries. Over the past decade, the number of years people live with disability due to musculoskeletal pain has risen significantly, driven by population growth and aging. This highlights the profound and lasting impact these conditions have on individuals and societies. Managing musculoskeletal pain requires a comprehensive approach that combines both non-pharmacological and pharmacological treatments. Non-pharmacological measures such as weight loss, exercise, and physiotherapy are often the first steps, especially for conditions like osteoarthritis. When these are not sufficient, pharmacological options, including topical and oral medications, are considered. The goal is to tailor treatment to each individual's needs, balancing effectiveness with safety. This integrated strategy helps maximize pain relief while minimizing risks and side effects. Topical nonsteroidal anti-inflammatory drugs, or NSAIDs, have emerged as an important option for managing musculoskeletal pain. Unlike oral NSAIDs, which are taken by mouth, topical NSAIDs are applied directly to the skin over the painful area. This allows for targeted pain relief with lower systemic exposure, reducing the risk of side effects. Common topical NSAIDs include diclofenac, ibuprofen, and ketoprofen, each available in various formulations such as gels, creams, and sprays. Their effectiveness and safety profile make them a valuable part of modern pain management. Robust evidence from systematic reviews supports the use of topical NSAIDs for acute musculoskeletal pain, such as sports injuries, strains, and sprains. Studies involving thousands of participants have shown that topical diclofenac, ibuprofen, and ketoprofen can significantly reduce pain intensity, often by at least 50% within a week of starting treatment. Number needed to treat, NNT, for these medications is low, meaning that many patients experience meaningful relief. This makes topical NSAIDs a practical and effective choice for short-term pain management. Topical NSAIDs are also effective for certain chronic musculoskeletal conditions, particularly knee and hand osteoarthritis. Systematic reviews show that diclofenac and ketoprofen can provide significant pain relief over periods of 6 to 12 weeks. While the number needed to treat is higher for chronic pain than for acute pain, these medications still offer a valuable alternative for patients who may not tolerate oral NSAIDs. For those who benefit, topical NSAIDs can reduce the need for stronger medications and their associated risks. One of the main advantages of topical NSAIDs is their safety profile compared to oral NSAIDs. Oral NSAIDs, while effective, are associated with systemic side effects, especially gastrointestinal and cardiovascular risks. Topical NSAIDs, on the other hand, deliver the medication directly to the affected area, resulting in lower systemic absorption. This means fewer serious side effects and a better overall safety profile, particularly for short-term use in acute pain and for older adults who may be more vulnerable to complications. Topical NSAIDs are generally well tolerated. Most adverse events are mild and limited to the site of application, such as redness, itching, or mild irritation. These reactions are usually transient and occur at similar rates as with placebo. Systemic side effects, such as those affecting the stomach or heart, are rare with topical use. In chronic use, local reactions may be slightly more common, but serious adverse events remain very uncommon. This favorable safety profile is a key reason why topical NSAIDs are recommended as a first-line treatment for many musculoskeletal conditions. Concept of number needed to treat helps us understand how effective a medication is. For acute musculoskeletal pain, topical diclofenac has an NNT of about 1.8, meaning that for every 2 people treated, one will experience significant pain relief that would not have occurred with placebo. Ibuprofen and ketoprofen also have favorable NNTs. For chronic pain, the NNTs are higher, but topical NSAIDs still provide meaningful relief for many patients. These numbers highlight the practical benefits of topical NSAIDs in real-world settings. Leading medical organizations now recommend topical NSAIDs as a preferred treatment for mild to moderate musculoskeletal pain, especially in conditions like knee and hand osteoarthritis. Guidelines from the European League Against Rheumatism, the American College of Rheumatology, and the Osteoarthritis Research Society International all support the use of topical NSAIDs as a first-line option. These recommendations are based on strong evidence for both efficacy and safety, making topical NSAIDs a cornerstone of modern pain management protocols. While topical NSAIDs are the most studied and recommended, other topical products are available, such as capsaicin, salicylates, and menthol. However, the evidence for their effectiveness is weaker or inconsistent. For example, capsaicin may provide modest pain relief, but often causes burning sensations that can be intolerable for some users. Salicylates have shown limited benefit in recent studies. As a result, the role of these alternatives in managing musculoskeletal pain remains uncertain, and topical NSAIDs remain the preferred choice. Despite the strong evidence supporting topical NSAIDs, there are still important questions to answer. For instance, more research is needed to determine the best type, dose, and formulation of topical NSAIDs for different conditions. There is also a lack of head-to-head comparison studies between different topical NSAIDs. Additionally, most research has focused on osteoarthritis, leaving gaps in our understanding of their effectiveness for other chronic musculoskeletal conditions. Addressing these gaps will help optimize pain management strategies in the future. Musculoskeletal pain imposes a heavy economic burden on individuals, healthcare systems, and society as a whole. Direct costs include medical care, medications, and treatments, while indirect costs stem from lost productivity, disability, and absenteeism. In the UK, the combined direct and indirect costs of back pain and arthritis exceed £20 billion annually. These figures underscore the importance of effective pain management strategies, not only to improve individual health, but also to reduce societal costs. Impact of musculoskeletal pain extends beyond physical symptoms. Many sufferers experience emotional challenges, such as depression and anxiety, and may feel isolated or unable to participate in social activities. Surveys reveal that a significant proportion of people with chronic pain have lost jobs, experienced relationship strain, or struggled with mental health issues. Addressing these emotional and social aspects is a vital part of comprehensive pain management. Non-pharmacological approaches play a crucial role in managing musculoskeletal pain. These include lifestyle changes such as regular exercise, weight management, and physiotherapy. Such interventions can improve mobility, reduce pain, and enhance overall quality of life. They are often recommended as the first step in treatment, especially for conditions like osteoarthritis. Combining these strategies with pharmacological treatments can provide the best outcomes for many patients. Topical NSAIDs are particularly useful for mild to moderate musculoskeletal pain, especially when localized to specific areas like the knees or hands. They are often recommended when non-pharmacological measures alone are insufficient, or when oral NSAIDs are not suitable due to potential side effects. Their ease of use and favorable safety profile make them an accessible option for many patients seeking pain relief. Topical NSAIDs come in various formulations, including gels, creams, sprays, and plasters. The choice of formulation can affect how the medication is absorbed and how convenient it is to use. Patients should follow instructions carefully, applying the product only to intact skin and avoiding contact with eyes or mucous membranes. Consistent application as directed is key to achieving the best results while minimizing the risk of local irritation. While topical NSAIDs are generally safe, it's important to be aware of potential local reactions, such as redness or itching. These are usually mild and resolve on their own. Rarely allergic reactions can occur, so users should discontinue use if they experience severe irritation or other unusual symptoms. Patients with certain skin conditions or allergies should consult a healthcare provider before starting topical NSAIDs. For acute musculoskeletal pain, topical NSAIDs are typically used for short periods, often less than 2 weeks. For chronic conditions like osteoarthritis, they may be used for longer durations, but ongoing assessment is important to ensure continued benefit and monitor for any side effects. Patients should follow their healthcare provider's recommendations regarding duration and frequency of use. Patient preferences play a significant role in the success of pain management. Some individuals may prefer topical treatments due to ease of use, fewer systemic side effects, or personal comfort. Ensuring that patients understand how to use topical NSAIDs correctly can improve adherence and outcomes. Open communication with healthcare providers helps tailor treatment to individual needs and preferences. Certain groups, such as older adults or those with multiple health conditions, may be especially vulnerable to the side effects of oral NSAIDs. For these individuals, topical NSAIDs offer a safer alternative for managing localized musculoskeletal pain. However, as with all medications, individual risks and benefits should be considered, and ongoing monitoring is recommended. Topical NSAIDs can be used alongside other treatments, including non-pharmacological measures, and in some cases, other medications. Combining approaches can enhance pain relief and improve function. However, it's important to avoid using multiple NSAID products simultaneously to reduce the risk of side effects. Coordination with healthcare providers ensures safe and effective treatment plans. Regular monitoring and follow-up are important when using topical NSAIDs, especially for chronic conditions. Healthcare providers can assess effectiveness, check for side effects, and adjust treatment as needed. This ongoing partnership helps ensure that patients receive the maximum benefit from their pain management plan while minimizing risks. Ongoing research is exploring new formulations, dosing strategies, and applications for topical NSAIDs. Scientists are also investigating their effectiveness for a wider range of musculoskeletal conditions beyond osteoarthritis. As our understanding grows, we can expect more personalized and effective pain management options in the future. Educating patients about the correct use of topical NSAIDs is essential for safety and effectiveness. Clear instructions on application, frequency, and duration help prevent misuse and maximize benefits. Patients should also be informed about potential side effects and when to seek medical advice. Empowered with knowledge, patients can take an active role in managing their musculoskeletal pain. Summarize: musculoskeletal pain is a common and impactful health issue worldwide. Topical NSAIDs offer effective and safe relief for both acute and some chronic conditions, with strong support from clinical guidelines. Their favorable safety profile, especially compared to oral NSAIDs, makes them a valuable option for many patients. Ongoing research and patient education will continue to enhance pain management strategies in the years ahead. As our understanding of musculoskeletal pain and its management evolves, the role of topical NSAIDs is likely to expand. Continued research, innovation, and collaboration among healthcare providers, researchers, and patients will drive progress. The ultimate goal is to provide effective, safe, and accessible pain relief for all who need it, improving quality of life and reducing the global burden of musculoskeletal conditions. Musculoskeletal pain remains a significant challenge, but advances in topical NSAID therapy offer hope for millions of sufferers. By combining evidence-based treatments, patient education, and ongoing research, we can continue to improve outcomes and quality of life. Whether for acute injuries or chronic conditions, topical NSAIDs are a key tool in the modern management of musculoskeletal pain.